Well, welcome back to the Social World Podcast. I'm Dave Niven, and as usual, it's a delight to have your company. If you want to Google it, you just Google Thoughts on the Social World, and you will now see the 167 episodes that we've had of the program over the last 11 years. And that pick that figure up, 11 years. That's quite coincidental with whom I'm about to talk to. Because today I've got a very special guest, the Chief Social Worker for Children in England, Isabelle Trowler CBE, who also, just by chance, happens to have been in post as the very first Chief Social Worker for Children in England for 11 years. Welcome, Isabelle, to the programme.
Good morning, David. Hi.
Right. Well, look, I mean, you must have seen so many changes over these 11 years, as the kind of, if you like, the initial chief social worker for children. I mean, has it been a devastating sort of experience, or has it been a worthwhile experience? Has it been a wonderful experience? What's it been for you?
Oh, well, look, it's been a wonderful experience, I have to say, and I would not have been in it for 11 years if it hadn't been, because it is quite a long haul. I'd say that, almost all of those 11 years I've worked alongside Lynn Romeo, who's the Chief Social Worker for Adults, and she's retired in January this year. And we've got a new Chief Social Worker for Adults arriving in January, and I'm really looking forward to working with her. Her name's Sarah McClinton. But so I've had a good companion through those 11 years. We've learnt the ropes of Whitehall and how to operate within government, which has been fantastic learning. And I have seen some changes in practice and how things work, but also not as much has changed as you might imagine. And we've been on, over those 11 years, I have been on with the Department for Education and the children's sector, this massive journey of building in a national infrastructure for child and family services, and really critically building the evidence base about what's the most effective way to work with families facing multiple difficulties. And that's brought us to a really positive place. Today we've got a new government in place. It's the first time that I've been in this role when we've had a Labour government. So that is a big shift. And we've got a really clear mandate that we are the Department for Opportunity, and that we've got a really strong focus on the need for families to have security and to focus on reducing child poverty. And we've got a great new reform agenda with new money on the table and a lot of learning across those 11 years,
You
which has
sound quite
helped.
optimistic.
I'm very optimistic. Yeah,
Oh,
I am.
by the way, Isabel, cut your video, would you, and it'll make the bandwidth better? Thanks.
Okay.
So look, the optimism then, obviously, but we've also just heard Rachel Reeves talking about sort of 5% cuts, and it would be, I think, the Department for Education that would be one of the ones cut. Is that right, or am I picking this up wrong?
Well, I'm not aware of any cuts. In fact, we've just in the last 2 or 3 weeks had I mean, it's really great news, but we've got over £500 million, which will be ring fenced for prevention work with families.
Excellent.
And so
Right.
that's not all of that is new money. It's about, so one of
Mm.
the complaints that local governments had is that they've had many different grants and lots of different strings attached. And so there's been an effort to consolidate some grants, but also the Deputy Prime Minister was successful in getting money on the table for improving services for families at local
Yeah.
level. So we're really pleased.
Well, you've been a real champion of the CSC reform program, including safeguarding reforms. I mean, do you think that this is going to give a much needed boost to that project?
Yeah, no, absolutely. And I think, what I see from my perspective is that this has been a long haul over the last few years. Local authorities, despite, massive decreases in budgets, that they have been building a really clear, very practice-focused evidence base about how we can keep families together safely and reduce the need for care. We've actually got fewer children going into care proceedings. That's gone down recently by about 13%,
Mm.
which is fantastic. That we've got a decrease in the number of children coming into care for the first time. Now, that doesn't include unaccompanied asylum seekers, which accounts for the overall increase in numbers of children in care. But local authorities have been working really hard to keep families together, and you can really see the change in the data. We've got more social workers in child and family services than we've had. We've got 5% more social workers, and actually we're starting to see caseloads come down as a result of that. So we're in a
That
good
sounds it
space.
sounds very positive. I mean, and I've looked at the agenda, the reform agenda. I think it was called what, Stable Homes Built on Love, that was launched not too long ago. But it's all about early years again. Thankfully, I thought that had not disappeared, but had taken a bit of a back seat for a while. But reading what you're doing, it sounds very much like that because I did a lot of work at one point with Tessa Joel on
Yes,
Pure Start.
right.
The first thousand, we ran a few conferences together on the first 1,000 days of a child's life.
Yes,
And
yes.
I mean, I'm so pleased to see that getting a higher billing, if you like, again. I
Yeah.
presume you would agree that's necessary.
Yeah, no, absolutely. And I mean, I think it's important to say that stable homes built on love was the previous government's policy position.
Mm.
Our Secretary of State, Bridget Phillipson, has recently presented what they call a command paper in Parliament about 2 weeks ago, and there is a new policy statement. It's an extensive
Mhm.
document for keeping children safe, helping families to flourish. And you'll see that a lot of what we have done is continuing, but there is without doubt a very strong focus on families, younger children, getting children, school ready,
Mm.
and also making sure that there's this continuum of services depending on levels of need. So obviously you've got a whole range of universal offers to families with young children, with health visiting and maternity services, etc. Then you've got the family hubs, which are I think we've got in 75 local authorities, got huge investment in early years. And
Mhm.
as I say, lots and lots of changes happening, bringing together targeted early help with children in need. Because
Yeah.
one of the things that families tell us, and we can see really clearly, is that families tend to get bounced around the system, and they hate it, obviously, and they need us to be, to offer stability
Mm.
of intervention as well. So,
No,
um,
that sounds very positive, I've got to say. I mean, I'm really thankful that we're resurrecting things that seem to have kind of gone under the blanket for a while.
yeah, it's yeah. So I think that we talked about what I would say to social workers going forwards and into 2025. But I think it's a good time to stay in the profession, and it's a good time to join the profession. I think that there's everything to play for. It's a lot of hard work. I think families are facing huge social difficulty. We know we've got many more children living in poverty. So there's
Mm.
some real challenges, and that certainly is the feeling that practitioners have on the front line. And I speak to practitioners a lot in my job and do quite a lot of
Mm.
visits and have all kinds of mechanisms to keep close to the front line. And the social circumstances for families feel very, very uh, deprived and intense, and particularly around housing.
Right.
um,
Yeah.
that's been very interesting. I mean, housing's always been an issue for families, always, in the whole of my 30 plus
Mm.
years career.
Mm.
But practitioners are certainly finding that the lack of suitable housing has all kinds of knock-on impacts, which is very, very hard to resolve.
It's fascinating, isn't it? The way the world changes. I mean, I'm just reflecting as you're talking there. I remember back in the 1970s, one of my first jobs was as an unqualified social worker working with homeless families. That was the title of it.
That's right.
And,
Yeah.
and I
And
mean, the
it's
world comes and goes, doesn't it?
it does. And in fact, somebody asked me on another podcast actually, what had changed. And I made the point, and I really think this is that for families that we work with, I'm not sure that much has changed because most of the families that we're working with in children's social care, and that's, I
Mm.
accept at the heavy end of things, are facing, the same kinds of social difficulties that they were in the 1990s when I qualified and in the 1970s when you qualified,
Mm.
the sort of social problems that our families are facing on a daily basis, I think are
Let,
pretty similar across those decades.
let me take you up on that and a step forward, if I might, because I mean, I know you're well aware. If you like, the new difficulties that are facing social work, the new challenges, if you like, with I mean, internationalization as well as kind of online threats and so on. I mean, things like human trafficking, human slavery,
Yeah,
forced marriage, and all the grooming issues to do with county lines and the internet and everything like that. All these new headings that are coming in with the same result. They threaten families, they threaten
yeah,
children, and
yeah.
social workers are there as one of the bastions of support. I mean, how do you feel about the new challenges?
Yeah, well, I mean, obviously it's there are, new challenges. If you've just listed some of them. I think that the ones that we're most familiar with now is child sexual exploitation and criminal exploitation. And there's been a huge amount of work in local authorities in both those areas of practice and across safeguarding partnerships, I should say, to find effective ways of reducing the harm to those children.
Mm.
And then, yeah, and I again, human trafficking, forced marriage. Of course, those things have always been happening, but they're just much more on our radar now. And of course, the big threat, as we know, to children and young people is internet safety. So there are a range of uh, subject knowledge that social workers need to develop and that local authorities have in the statutory sector anyway have the mandate to make sure that social workers are um, uh, uh, have that knowledge. I'd say two things. I think firstly, because we now have, and this is one of the shifts that we have seen over the last few years, that we in 2017 we changed the law so that we've now got post-qualification standards for child and family social work.
Yeah.
We're just reviewing those at the moment, and they will come out for consultation shortly. And it'll be really important to make sure that those areas that you've just described are really clearly articulated. So, what's the knowledge base you need, but also what's the skills base that
I do
you
hope
need?
so. I do hope so. I mean,
Yeah,
I was
yeah,
talking to a financial crimes expert on the podcast a few weeks ago, and you're talking a minimum of about $500 billion in terms of the turnover from trafficking,
yeah, yeah.
lots of it involving children.
Yes, absolutely. Yeah.
It's bigger than any one government, I think, and that's the issue, I suspect.
Yes. Yeah. Yeah.
Um, well, let me ask you something else then about innovations in social work, because I mean, I think I'm beginning to see changes a bit, some coming from abroad, but some local as well, in terms of how we actually practice. I mean, for example, I did a podcast with a professor of social work from China who's
Yes.
been working for about a decade now, turning social workers into first responders
Yes.
for earthquakes, tsunamis, major catastrophes, and so forth. That because the skills that social work brings to the table are so helpful at that point in time. And I just wondered if we could begin to see changes like that within our educate social work education system, and if you come across things like that at all.
What
Hello?
specific things, David?
Oh, sorry, to do with new courses, new ways of using
Hello?
social work. Hello?
Yeah.
Hmm. Okay, so there has been quite a lot of difficulty in children's services, especially over the last few years, in terms of recruitment. What's your take on that now?
Yeah. So that's really interesting. So the we don't have a problem recruiting and retaining social workers in the profession. And so we've got more social workers registered with Social Work England than we've ever had before. We've got over 100,000 social workers in
Hmm.
England. And so that's great. So we've got this committed group of social workers that join the profession and they stay in the profession. Then we've got social workers, and it's about 36,000 social workers in local child and family, children's social care services, local government.
Yeah.
And the problem that we've got there is turnover. So there's a high vacancy rate, and but it's not that we haven't got agency workers that are filling those. Most of those vacancies are filled by agency workers. But the problem, of course, is that creates instability in organisations.
Mm.
So social workers don't leave the profession. Um, a lot of them stay within child and family services, but they move around a lot. And we've got this agency, there's about 17% of our workforce are agency, and it's an
Yes.
increasingly popular route. And we've just actually, government has just recently put out statutory guidance on what we're expecting local authorities to do to try and limit the amount of movement across local authorities. And there's
Mm.
some really, really important principles in it. So, for example, is that for new social workers joining local government, that they can't become agency until they have done 3 years permanent employment
Interesting.
in local government, because
Mm.
I think it's absolutely crucial for newly qualified social workers to really understand and the practice and the role, and that I think you're much better placed to do that well and with confidence if you're really established as part of an organisation and that
Mm.
you've got real stability. There's a range of other rules that are being put in place, but I would also say that we have to value our agency staff, and that there are some very good reasons why people do eventually move into agency, and not least because often they want to stay in practice, and want, a whole range of family reasons, etc. They want some flex. But we're trying to limit how much that happens because of the impact that it has on children and families.
Well,
Uh,
absolutely.
yeah, because it's
Mm.
very, very disruptive for them to see, a string of social workers coming and going.
I
So
do
yeah,
remember in the early, sorry, I remember in the early days when London-based, for example, it was easy for people every couple of years to move from one London borough to the next, to the next, to the next.
yes,
And
yeah,
however, in the rural parts of the country, the rest of the country, I mean, I found that social work essentially a lot of it was lifestyle choices as much as anything.
yes, yeah,
So, for
yeah.
example, Northumberland or Cornwall or wherever, people would go because they would like to live there as well as work there. But other places, people would just flit sometimes from job to job because of the easy accessibility of the next door neighbor.
Yes, yeah, exactly. So, the London, for example, is a classic. There's 32 local authorities. You can
Mm.
get from across those 32 local authorities from one side of London to the other in probably, an hour and a half max. So you really have got a lot of options.
Mm.
So yes, but I think that there's also something to just consider about, we have to ask ourselves why social workers want to be agency. And the feedback that we get from that part of the workforce is that and it is in part about the pressures that they experience in in certain local authorities, that
Mhm.
they just feel like they have more control and autonomy, um, and that yes, that they have the freedom, I suppose, to not be tied to one place. And so, and I can understand that, that people make different choices for different reasons, but I do think that there's a limit to how much instability that we can oversee. So
No, I
hopefully
totally.
these new arrangements will help stem some of that
Totally
movement.
agree. Totally agree with you on that. And I really hope that what you've said actually gets traction. Simply, too, for the fact of I do the stress that social workers suffer from, and especially if they're people down within their teams and so forth, and having to shoulder extra cases, extra burdens, and so on. Because I remember in practice all the time, whether I was managing teams or I chaired a couple of partnership boards for several years as well. And effectively, the reflective supervision got lost.
Mm, mm. Yeah,
It's all about looking at cases, managing the cases, and you can understand that, but nothing about what's between. I mean, because the social workers' tools are between their ears,
yeah, yeah.
and they really need to have that health maintained. And I often feel that reflective supervision, how are you, and how can we support you individually, gets lost sometimes.
Yeah.
Would that be your experience as well?
No, no, absolutely. And I think that if you look at the data on local authorities and agency, there's definitely a correlation between your stronger authorities that have a good track record in effective practice with families, well supported staff, that their rates of agency are much lower.
Mm.
That I went to a visit in York recently, and they've got a fantastic DCS there, sorry, Director of Children's Services there, and fantastic team. And they have now, they don't have any agency workers at all. In fact, I think they might even have a waiting list of people wanting to work
Right.
for them. But
I didn't know
it's,
that.
so there it is very varied across the country. But we know that if you provide the right practice conditions, that social workers feel that the senior leadership has got their backs in, a very fraught day-to-day work context, that they do get that supervision, not just one-to-one, but possibly group supervision as well, really helps. That they've got opportunities to develop their practice, knowledge, and skill, then that helps enormously to retain staff.
Mm.
And just also, David, I mean, the other thing, there's been quite a few changes that we've made, and one of them is that we have now introduced for the first time a national framework for practice for children's social care. This is statutory guidance, and it is absolutely about what we want to see practitioners do, but it's also very clear about what we expect leaders to do, and to create those right conditions for practice. And then we've got
Mm.
two other things that linked to that. So we are publishing a suite of practice guides, which are the kind of best evidence in relation to certain areas of practice. But also, and some of your listeners might be interested, is that we now have a public facing dashboard which shows by local authority, and you can do all kind of comparative analysis, etc.,
Mm.
about how different local authorities are managing. And of course, some of the data over time will show agency rates, etc., and we can see sort of patterns across regions as well as individual local authorities.
That will be very helpful. And I mean, I might as well say at this point, because I mean, it's good for people listening to know. When I actually publish this podcast, the front page, which essentially is text, apart from having a nice picture of yourself and whatever on it, will have lots of links, any links that you
Oh,
want,
good. Yeah.
and we'll put them on it, and things like you've just mentioned, we'll make sure that all of that's on there, so that people can actually easily, follow up what you've been talking about. But let
Yeah,
me,
no,
can I
absolutely.
just ask a couple more areas of work that I'm quite interested in? I mean, a lot of people abroad listen to this podcast as well. And I wonder, I mean, do you have much contact with colleagues of a similar sort of position abroad? And what, because I've always been in favor, if you like, to not put it too bluntly, of stealing from the neighbors,
Yes.
and looking to good projects and good innovative kind of things happening elsewhere. I mean, are you very much in favor of that? Have you any kind of experience of that? And would you recommend that as something to actually build on?
Yeah, no, absolutely. And I think that those international links are, hugely helpful. And, I have some of those obviously that are live. And I'm just thinking one of the best examples, I suppose, which has been emerging over many years, is the role of family group decision making, and in particular family
Mm,
group conferencing, which,
mm,
as we know, originated in New Zealand. And we've been looking at very closely over the last few years here, and have done one of the largest randomized controlled trials on family group
yeah,
conferences
yeah.
in the world, actually. And when we've been talking about this over the years, we've really used the expertise, particularly from the uh, previous chief social worker in New Zealand, who came over here and helped us think through that and how we might want to approach it. And again, we're very much hoping that we will see in new legislation that family group decision making becomes an entitlement for families. So that, that learning from New Zealand has really influenced our thinking,
Mm.
um, alongside obviously people like the
No,
Family Rights Group and various people that have been pushing for that for many years. So
I've always
yeah, it
thought if
does.
that handled properly, that does make good sense.
Yes, yeah, yeah.
Um, there has always been, and I know you would agree with me, but over the decades, there's been a kind of a roller coaster in terms of the relationship between education and employers. How have
Oh,
you?
you mean social work education?
Yes,
Yeah,
sorry, yes, sorry,
yes,
yeah, universities, for example,
yeah,
and
yeah.
employers, with each kind of thinking sometimes that the other's not doing something either well enough or often enough or whatever. And
Yeah, yeah.
um, I mean, what's the position in your mind at the moment? Are we in a better place?
Yeah, I think we are actually. I totally recognise what you're saying, and that's always historically been a really fraught conversation. But over the last few years, we've been funding something called teaching partnerships, which is this um, arrangement between, exactly as you say, social work educators and local authorities to work much more closely together, to make sure that students are getting a good quality social work education and also insight into different areas of practice. And I think that if I think sort of 10, 15 years ago, I think that debate was really fraught. I think that's much less so. And
I'm glad to hear it. I mean, because about that
yeah,
time, for about 3 years, I did a stint for the Department of Education as in the newly qualified social worker program
okay, yeah,
for the 15 Southwest authorities.
yeah,
I vividly remember, let's just put it this way, the differences that were going on then. They were almost quite toxic, I thought, at some points.
yeah, yeah.
The
And
relationship.
I think yes, I'm not saying that there aren't any debates to be had, but I think also what's happened, and a lot of the work that I've been focused on, is post qualification. So
Yeah,
that's sort of taken the pressure a bit off initial education, and the sort of consensus is that we have a generic first qualification, and then the post qualification landscape is where you really hone in on your specialist area. And I think that has really calmed the debate down quite a bit. Um, but it is, I mean, I'm a staunch defender of specialism. I think that that if you aren't particularly, for example, if you are on a generic course and you don't have a statutory placement, for example, or you not coming into contact with higher level needs or significant harm, then moving straight into a local authority setting can be really hard. So
yeah.
it's really making sure that everybody in those first couple of years are properly supported and developed. And that really helps, I think, people stay with it, which I think is a fantastic career, I have to say. And I know I've had a bit of a, particular route, but I think, for many of us who stay in social work, there's so many avenues that it takes you. I just think it's a fantastic qualification to have. And, statutory work, I think, is really hard. It's intellectually, some of the most challenging stuff you'll ever do, because it's really about that relationship between private family life and the state. And we're often, the go-between between those two things. But that's just, part of what social work can offer. So yeah, I think it's
Yeah.
a great working life, I think.
Well, let's talk a little bit then about how, in the last few minutes, one of the things that's really kind of dominated my experience of social work, especially over the last sort of 20 or 30 years, has been our image in the media.
Yeah.
Um, and, when I was in position, before like BASWA, wherever, doing various things, I was catapulted in with no training whatsoever and had to learn it very fast. And I know that colleagues now get a little bit better training and preparation for that, but it's still an uphill battle in many ways in terms of how we're perceived, and fighting to remain an equal partner in the shop window, as it were.
Yeah. I mean, it's interesting, isn't it? And I have lots and lots of debates about that,
Mm,
because some social workers really hanker after that public recognition,
mm,
but some social workers don't, and in fact feel the opposite, in that, we definitely don't come into this profession to be, for the glory, or, for public acclaim, and that we tend to be very stuck in this idea of us not being understood or not being liked. And actually, very recently, an academic, and again, you can put the link in to the podcast if you'd like,
mm.
really challenges this notion that the public don't understand and, are negative about social workers. And I think it was actually in Scotland, they did a whole piece of work on this and actually found that the public understood very well what we do and certainly did not feel negative about the profession. And this piece is worth reading because it's really sort of pushing back on that
Well,
narrative.
please send me the link
Yeah,
if you can, please, or get some.
yeah,
I mean, I'm more than happy to.
fascinating. And
I,
then I think I think that it's obviously, I mean, I think there are far fewer examples actually of when social workers are getting a hard time in the media, but it does still happen. And, usually on the back of a
it
series.
prompted. I'll tell you this, Isabel. It prompted me to go in. I mean, ran a training company for a while, and a lot of stuff I did here and in America was I put a course together about managing the media in a crisis.
Mm,
And effectively, of all, because I mean, all the sometimes very bumpy experience I had myself and how to deal with it. But basically, I've always thought that if the local social workers were allowed to talk to the media a bit more, only if they wanted to, of course,
yeah,
and actually explain to maybe a couple of local journalists, the local free newspaper, the local free radio station, whatever, just a little bit more about all the successes we have, all the good news
yeah,
that eventually, when that one call came in of a new family that was in crisis and there was a lot of trouble and there was suspicion and all sorts of things, that it would just help that little bit of time for the social worker to get his or her feet across the threshold and
yeah,
in there and trust. It would help the trust if
yeah.
if we were much more kind of balanced in terms of the views of the media.
Yeah. I mean, I think there's two things to say about that before we close. And I think the first thing is that local authorities do that much more than they used to.
Mm.
That I see lots and lots of examples of local authorities, using exactly as you say, the local and regional press to showcase, really positive work that they're doing alongside families. And also, I think BASWA has done quite a lot of that. I think you're much more likely to see BASWA representatives in the media and pushing back on some of
Oh,
that kind of
goodness.
media negative script, which is
Wasn't
really
always the
good.
case.
Sorry?
I'm saying thank goodness it wasn't always the case.
Yes, no, yeah, I definitely see more of that. And but I just a little story is that when I started this and um with Lynn Romeo, that we invited all the big media outlets to a meeting in the department, and really to try and thrash out why do they do this. And they said, no one's ever going to read the good stories. People are not interested. The public like to read, a bad story. And the other thing that was really fascinating was that the people that are reading those are just as likely to be social workers as anybody else. So it's tricky, and I don't know how much of our energy we should be putting in trying to force the public to read good stories, because I think our best advert is our own practice and leadership, and that
I
so
know
that
what you
every
mean. Yeah.
interaction that we have with families is the best that it can be in the circumstances that practitioners and managers find themselves in, and that that's really where I think our focus should be.
It is
Um,
crucial. All of what you've just said, of course, is crucial. I do think I'd like to suggest, though, that as 98% of the population, if not more, get their opinions and their news from some kind of media, whether it's written or whether it's broadcast or whether it's social media,
yeah,
that we've got to be in there with our
yes,
views. We've got
but
to be
David,
in that shop window.
1 in 6 children in this country at some point has a social worker.
Wow,
1 in 6.
incredible. Yeah.
It is. And so, the idea that we're some kind of small, unknown
Mm.
little thing over here in the public sector is just not the case, is that 1 in 6 children access a social worker, a child in need at some point.
Okay.
So that experience um, of the child, young person, their family, that's what will change people's minds about the role that social work has and the positive impact that they can have.
Right. Final question, couple of minutes, if I may. We're coming up to a kind of a big holiday period now, and an awful lot of children in this country still are way below the poverty line, experiencing and seeing all this other kind of glut of kind of commercialism and everything going on. And
Yeah,
social workers are having to try doubly hard in some cases to sort of affect kind of balance and change and good feelings towards families. I mean, what message would you give as the chief social worker in England to children and family social workers, and maybe even tack on a little bit about people who might be considering social work as a profession? Would you like to just
yeah.
give a kind of a Christmas message, if you like?
Gosh, well, I suppose the first thing I'd say is thanks to everybody that won't be having a break over Christmas and New Year, because they'll be working. And, there are lots of social workers out there who'll be working over the festive period on, out of hours duty, etc. So, a huge thanks to everybody over that period. And a huge thanks to all of you for everything that you've done over this year, and, the years that I've been in this role, I can really see a sea change in the quality of practice. And whenever I'm out and about, I'm always, so impressed by all the brilliant work that goes on, and the commitment, to local children families is always palpable. So long may that continue. I think, and I have said quite a lot of positive things in this podcast, and that's because of the work that's going on in child and family social services. That we've got, a lot of good news. We've made, significant progress, and I think, from everything that I've, said, David, is that there's some real hope that we can make even more of a difference to children and families. And yes, so those of you that are listening, keep on carrying on the good fight. And for anybody that's thinking about social work, that I have no doubt in recommending it as a fantastic career option. It really is the best. It's a great working life.
Well, Isabel, it's been a pleasure having you on the program. I wish you a good holiday as well, and keep up the good fight, and thank you very much indeed for your time.
Thanks very much.